So we are here for our health segment of the day with our resident physician, Dr. Julie Chen.
Hi, Zara.
How are you?
I'm good. Thank you.
So happy you're back.
Thanks for having me.
I learn so much every time. And we're here with Dr. Amber Piku and Lupe Nunez.
Hi.
Bay Area locals. What's up, ladies?
Not much. Ready to
much.
get some questions answered.
I know. We have so many questions for you.
Ready to answer them. Thanks for coming.
My gosh. I mean, so where do we begin with just basic getting pregnant, birth control, things that, you know, are, whether you're 18 or you're a little bit older, we're still, you know, birth control for women is still such a big issue, right? And into your 50s. You know, Lupe, we were talking about it earlier. What was your question?
My question is, if a person is over 40 years old, has not been on birth control, are they still able to get pregnant?
Definitely, if you're still having your periods on a regular basis, and you mentioned earlier that you actually are still having very regular periods. So
For everybody in the world to know.
yeah.
That's okay, girl. So am I.
And we're learning along, and that's something that's important, is because if you're having irregularity or that there's indications that there might be some menopausal symptoms, that's something that's different. But as long as you're having your periods, there is still a chance that you could be pregnant, and that's something to keep in mind. There's a lot of patients that come through my clinic where they had babies much later on, and it was a surprise. It was a pleasant surprise, but still a surprise. And that's something that's important to keep in mind. And so if there's any questions about that, definitely check with your OBGYN and take a look at, you know, what concerns you have about specific birth controls, if you have those questions, and whether, you know, having kids is still something that you want to entertain as a possibility, if at all.
Okay, and then do you have to have any kind of test taken so that you check whether you are fertile or not? And are they pricey? Is it an expensive process?
I think the extent to which you want to go to that level is depends on whether you're actually trying to get pregnant or not. But you can check for certain hormone levels, like what we call FSH, follicle stimulating hormone, or luteinizing hormone, LH, to see whether you're potentially close to menopause or not. If there's any questions about regularity of periods, if you're very regular and you want to actually check at fertility, they can actually do tests on like egg levels, fertility levels, and things like that. Yeah, but that's definitely something that, depending on the indication, insurance may or may not cover for, and so that comes into the question of whether you're trying to get pregnant or whether you're just curious whether you should be using birth control or not.
Okay, thank you.
Yeah.
I think it's hard because, you know, as young girls, you know, you always, you know, some people's periods are regular and some are not. And so just because you may have an irregular period, that doesn't mean that you can't get pregnant either. Right. So you still should be careful with the birth control that you use.
Absolutely. And a lot of times women who have, you know, things like polycystic ovarian syndrome, they may think that it's hard to get pregnant and they don't use birth control, but there is still that chance. And a lot of women have that misconception that, you know, if it's right after their period or right around the period, even during the period, that they're not going to get pregnant. That's not always the case, because the sperm in the can still inseminate even days after the actual event of the sexual encounter.
So at what stage then, at what age does menopause, when are we premenopausal?
It really depends from person to person. Again, we had talked a little bit briefly earlier about the fact of what your mother's, you know, age might have been. But, you know, even if your mother was early on, that doesn't necessarily mean yours is always going to be that way. Again, those levels we talked about with the FSH and LH is something that we can check. And again, the clinical symptoms are important. Are you starting to become irregular when you know, you used to be very regular? Are there hot flash symptoms? And even the hot flashes aren't necessarily perimenopausal. It could even be thyroid or other endocrine issues. So that's something that definitely is important to keep in mind, because a lot of women, especially as they get older, they're not sure. They think that the hot flashes are just their menopausal symptoms or perimenopausal symptoms, but it could actually be thyroid issues, because you can get hot flashes with the other endocrine issues. And as we get older, we also naturally have a kind of waning or diminishing thyroid function. And so that's something to really keep in mind as well. So getting a full evaluation and talking to the doctor about the symptoms and getting the labs done are important.
Is the main symptom the periods not being regular?
Not necessarily. It usually has some association to that, but sometimes you can be irregular and not be perimenopausal.
And what would be the best thing to do if you think that you're perhaps approaching that age or that stage? What would be the best thing to do? Is it vitamins? What would be something that
To kind of help with the
to
symptoms,
help with
you
the
mean?
symptoms,
Okay,
correct.
so I think first things first is to get an evaluation, because as we mentioned, the symptoms could not be associated with perimenopause, right? To find out really what's going on with the endocrine functioning and other factors. When you are clear about what's going on, supplements can be very helpful with some of those symptoms very early on. I have a lot of patients where they're concerned about hormone replacement therapy, whether it be cancer associated, family history of cancers, etc., things that they themselves are concerned about. And so we talk about supplements such as black cohosh, or even some of the progesterone, potentially more natural forms, or bioidentical hormones versus the actual hormone pills that you might get. That aren't as close to bioidentical as some of the OBGYNs like to give out. So a discussion is always very important with your OBGYN at that point.
Awesome. Thank you so much. Ladies, Lupe, Amber, thank you so much.
Welcome.
If you guys want more information, you can jet over to our website, and also click on the Dr. Julie on our website. So it'll take you right to her, so you can ask her your questions and get in contact with her. And we'll be right back.